Hi everyone, and welcome back to my channel. So we recently got new curtains and I really love how the blue looks as like a backdrop. I think it's so pretty. So yeah, I don't know, it's just like a new space that I'm filming in for you guys today. And I just wanted to give you guys a little bit of a life update and just sort of catch you guys up on everything that's been going on. And yeah, just sort of chat a little bit about, how everything's been going. So as many of you know, I've sort of been going through some medical stuff lately, and I've done a lot of testing and I've been seeing a lot of specialists to kind of figure out what's going on. It all kind of started last year when I had pain in my side and it really wouldn't go away, and I went to the doctor and the doctor found that I had a heart murmur, and after doing some tests, they found out that I have something called a bicuspid aortic valve. Instead of having 3 leaflets in my aorta, I have 2. It's a genetic thing that, I was born with my aorta like this. And I guess it's one of the most common birth defects that are that relate to your heart. So it's like a very common, out of like the birth defects that you can have related to your heart, the bicuspid valve is one of the most common as far as I know. So pretty much after testing, they found that I have a slightly enlarged aorta, and it's kind of a little confusing to me still because I have like what Finley's looking out the window. I have it's confusing. Okay, I'm gonna try to explain it. So you can have something called stenosis, aortic stenosis, which is a narrowing of your aorta, and that I have some stenosis, but I also have a larger aorta than I should have for my height, I guess, if that makes sense. I'm only 5'1", and I don't remember the exact measurements for the heart, the aorta, like the diameter of the aorta. And so I do have like a slightly enlarged aorta, but nothing at this time that needs any like medical treatment. And from what I've been told and sort of what I've learned about this heart condition, that the main thing is that I have to follow up with a cardiologist and sort of be seen by a cardiologist regularly to check the size of my aorta, and really look into, I guess what's kind of happens is like the valves in your aorta can sort of like weaken or get tired a little easier. And so at some point I might have to have valve replacement down the road at some point in my life. So I sort of have to stay on top of, how I'm feeling, and just try to, be aware of what's going on. So I've done a lot of testing and I've met with a lot of specialists. They also found out that I was anemic during that process. So I'm really trying to eat, in a way that would like give me more foods that help anemia. And so that's something that I've really been working on. And, in addition to that, I recently went to a geneticist actually, because they weren't quite sure whether I have this bicuspid aortic valve because of just like a random birth defect, or if I have it because it's related to a different syndrome that I have that is like the underlying cause of this birth defect, because this birth defect can be a symptom of different disorders. So I went to a geneticist. I actually met with them virtually, which was really nice. I met with the geneticist and like an assistant geneticist, I guess you could say. I think like a nurse practitioner maybe, and then also the geneticist. And they did like a full interview with me a couple days before the appointment, and it was like a 45-minute long interview about my family and my health and the health of my family members, and just as much information as I could provide them about everything. That's what I was doing in this interview, and they were so nice when they did that. So I gave them as much information as I could, and some of the questions were hard to answer, and the woman even said, like, it's okay, like not everybody has answers to these questions. Just, give the information to the best of your knowledge. And so that's what I did. And then a few days later, I met with the geneticist, and he was so nice as well. The process was very, you know, easy. And what he said to me was like, based on the information that I had given him and based on the test results and everything that he had seen, he suspects that I might have a connective tissue disorder. And I'm going to look up the exact pronunciation of this word. So I just looked on my phone to make sure I'm pronouncing this disorder correctly. So he asked me a lot of questions, and he suspects that I have a connective tissue disorder called Ehlers-Danlos syndrome. He asked me a lot of questions that when he, you know, asked the questions to me, I was like, he's like, do you have this? Do you do this? Like, does this happen? You know, back and forth. And I was like, yep. And he was like, okay, like, I suspect that you have this connective tissue disorder, because what he was saying, I believe, is that one of the symptoms of that connective tissue disorder is some people present with a bicuspid aortic valve, and that's what I have. So he actually ordered some genetic testing, and I'm going to be sent like a little bottle that I have to spit into. I know, gross. But I know it's all medical stuff. And pretty much they just collect a saliva sample, and then I send it back to them, like just through the mail, I guess, and they're able to test it and see if I do have this disorder or not. He said that it takes a couple weeks to get that information back, and he said that if I do have that disorder, the main thing that they can do for me is like some physical therapy and some, you know, sort of like lifestyle help type things, like where like the physical therapy will help with a lot of like the things that I'm struggling with, and sort of like help me kind of get into like a new routine, I guess. Hi, Finn. Goodbye, Finn. I was sort of nervous hearing the name of a disorder, you know, and just learning a little bit more about it. But at the same time, I felt really supported by the doctor and, you know, the person that was working with him. And they just gave a lot of great information, and they explained everything very well, and answered all of my questions. And yeah, I just thought that was really, really helpful. And I'm grateful to be able to get some more information. I will definitely let you guys know when I get the results of that testing, to see if I have that connective tissue disorder or not. It was really interesting when they were talking about like, you know, things that I've struggled with, and, you know, just asking these questions, and I'm like, yes, I've struggled with that, I've struggled with that, I've struggled with that. And so it's interesting, like, it's like puzzle pieces, you know what I mean? And it's like, when they suspect one thing, it sort of just like checks everything off in a box, you know, and I thought that was really interesting. So I am going to be getting that kit soon, and then I'm going to be sending back the sample, and I'll let you guys know as soon as I know more about that. So those are some of the health things that I've been struggling with, and just sort of what's been going on. I also wanted to share with you guys how everything's been going with my medication that I've been taking for my severe obsessive compulsive disorders. So I shared a whole video about how I've been taking a medication, and I've been having some really great success with the medication. I semi-recently decided to increase the dose a little bit with the guidance of my psychiatrist. I met with him and talked about it, and he thought I could try a little bit more to see if it helped. And I think that just, you know, how I felt after taking it for a while, it just wasn't the right amount for me. I ended up taking less. I ended up starting to take less, again, at the guidance of my psychiatrist. It just was not the right amount for me. And it's been really interesting to see how that experience has gone, you know, with trying new medications and trying different like dosages of medication, you know, and, you know, it was just interesting to see like the amount that I was at, and then how like the difference between taking a little less than the amount that I'm currently on, and then taking a little more than the amount that I'm currently on. I feel like what I'm currently taking is the right amount. I just felt like I didn't have as much clarity. So I tried an increase in the medication, and it just didn't feel like a good fit for me. So with my psychiatrist's guidance, I did reduce the dosage, and I feel pretty okay on this medication. Like I've said before, it's given me a lot of clarity, and it's just really helped with so much. Like I'm so much more able to function. I feel like I'm able to communicate so much better. I wonder if you guys notice in the videos, like I'm able to speak a lot more clearly. I'm doing much less editing. I'm just really, you know, feeling pretty good overall with the medication. It doesn't mean that I don't still have some difficult days. I definitely do. I've had some really big panic attacks over the past couple weeks. But, you know, I'm able to sort of see things differently, and I'm able to analyze what I'm struggling with a little differently as well. And that's been really helpful. So, yeah, the medication is going well, and I'm happy that I've tried, you know, that I tried something, and I, you know, tried a few different things, you know, definitely with the guidance of my psychiatrist, and I was able to find something that worked for me. I'm really grateful for that. Those are the main things that I wanted to share with you, just with, you know, mainly dealing with like pertaining to like medical stuff and like what I've been struggling with. And I do plan to share other like life update videos with you guys, just sort of share with you what I'm working on, what Sean and I are working on right now, you know, what my family and I are doing. I just shared a really fun video with Keely, actually. I shared a video that I filmed over the holidays where we set up our Christmas tree. The train, I got like a thrifted train, set that train up under the tree, and it was a really fun video. We just were like laughing the whole time. So make sure you check that out if you want to see Keely and I having a really good time setting up that holiday train. Thank you so much for watching, and leave any questions or comments below, and I will see you in my next video. Bye.